Assalamu alaikum. So we will continue. Last session we discussed the assessment and we took the sample and dots. Now we will continue with the assessment. So the assessment here, performing or doing assessment, initial assessment should be performed every 5 minutes. So if after the initial assessment, every 5 minutes we have to reassess the patient condition. If the condition of the client is unstable, if there is a change in the patient condition, so in this case, every 5 minutes we have to reassess his condition. If he is conscious and his condition is stable, in this case, every 15 minutes we will reassess the patient condition until the condition is being stabilized and we are sure that his condition is stable. Then either he will be transferred to the hospital for continuous care, or he will stay in the emergency room for after transferring to the hospital for observation for a period of time until they are sure that there is no further injury. Here, in case of cardiac problem, there are what we call it the adult change of survival. Adult chain of survival. In order to save life, in order to help the person, or to, in case of if something happens to him, especially in case of cardiac arrest or cardiac condition, what is the main thing that has to be there in order to save the life of the person? So the first thing, it is the early recognition. If you are recognizing the case early, in this case you can act early, so you will prevent the consequence of the cardiac arrest or any condition that the patient is having. This is mostly in case of cardiac arrest. Then immediate high quality CPR for the patient. So early CPR if we recognize and assess that the client is having cardiac arrest. So we have to do as early as possible the CPR. Because why it is recommended to be early as possible? What is the function? What is the function of the circulation?
Maybe they did.
Sorry?
Maybe they did.
Definitely, if it is for a long period of time, if the heart is not working for a long period of time,
Maybe.
it is dead. But what is the function of the cardiovascular system? You have to think of the function of the cardiovascular system. What is the function of it? What's the main function of it?
Pressure of blood.
Pressure has to be maintained, but for what? What's the main function?
Transfer
Of
oxygen.
Yes, transferring of oxygen and blood is carrying what? Nutrient and oxygen. Thank you. So it is it is carrying nutrient and oxygen to all body cell. Can your body cells survive without oxygen or nutrient? No. So if your heart stopped, if the circulation stopped, what's that mean?
They did.
There is no
Oxygen and nutrition.
no nutrient to the cells. So how the cell will take its energy? Nothing is there. Yes, there are some oxygen and nutrient, which is the within the blood cells, which is around the cells at that moment. But if there is no exchange of that blood, if the circulation is stopped, those amount of nutrient and oxygen, it will be consumed. So the cell is deprived from the oxygen and nutrient. So the cell will start to deteriorate. Our cells of the body, they are having different lifespan in this case. And the most sensitive cells are the cells of what? The brain. So if we delay in giving care, in this case, we might expect that there are some defects on the brain cell because of lack of oxygen and lack of nutrient. So when you act immediately, when you do CPR immediately, CPR, it means that you are trying manually, if the heart is stopped, to make the circulation, to send some oxygen, to send some nutrient by the pumping from outside, by the compression that you are using, by squeezing the heart. When you are compressing on the chest, you are squeezing the heart, so the amount of blood which is there inside, it will go out, and when you lift your hand, then the refilling will happen. So it will help in the circulation. It is not similar to the normal circulation, but it will work, it will help. Did you understand this point?
Yes.
So early CPR is a must. Because of that, the assessment, it should not last if the patient is unconscious, and the assessment, it should not last more than 10 seconds, the initial assessment. And the reassessment, it should not last in between the cardiac resuscitation and mouth-to-mouth breathing. It should not last more than 10 seconds. In order to not to deprive the brain cells from oxygen and nutrient. So early and continuous care, it will give more chance for the patient, for the victim to survive, and to survive without complication. Let us say if someone is having cardiac arrest and there is a delay or no one was there, then they recognize the case after few minutes, after 10 minutes. Definitely in this case, even if the heart starts to work again after CPR, definitely he might have some brain cells defect due to the deprivation from oxygen and nutrient. So because of that, we have to recognize the case earlier, assess the case as early as within a short period of time, within a second, then start CPR if it is needed. Then there is what we call it defibrillator. Defibrillator, which is automated machine that we will do cardiac, that will use it to lead to shock for the heart. That shock, it is as re-enhancing the heart to work again, because the heart, it has the impulses which is coming, it is due to an electrical impulse which is coming from the heart itself. You will take this, and I think you took some of it in biology in secondary school. Did you remember that? How the heart is working and how the impulses is coming? So it is initiated by the heart, and also the brain is having some control over. Then, so electric shock is there. There is a device. We will show you that the device and how does it work? It was called the defibrillator. Then effective advanced life support. If we have an effective advanced life support, an ambulance which has all the means of support for the patient, and a trained people, and also easily to reach within a short time a case or the coverage area to be within يعني not with a high distance. In this case it will be more effective. So in this case we have someone who recognize the case early. They know, يعني, we are giving health education to the people so they can understand when the person is having a problem and he is in need for an emergency. There are someone who are able to assist and to start CPR and to call for emergency medical support, and the emergency medical support is well organized and able to provide the care, and the ambulances and the trained people are trained well, and the ambulance is equipped with good equipment. Defibrillator is there. Now in many institutions it is a must that they have a defibrillator, and they might have a nurse or some medical support people. Then the last thing, which is the integrated post-cardiac arrest care. Yani the hospital, it has to have an unit, a cardiac unit for continuity of care. So if the people recognize easily, early, if CPR done immediately, if defibrillator is there and it is used properly with that client, and effective transport and medical support is there, and they transfer the client as early as possible to the hospital, and in the hospital there is ICU, in the cardiac intensive cardiac unit is there, and a specialist is there to follow up that case. In this case, the possibility for survival, it will be no, isn't it? If any one of those chains are cut, not there, possibility of death, it will be increased. Yani, if anyone is having heart attack and no one were beside him, what will happen to him?
Immediately.
He will die. No one is there. His heart stopped. So we will find him after that. If we recognize the case and we were there and we didn't do anything, just we were watching the client, it might be a minor thing, and he will wake up by himself. Also, in this case, he might die, isn't it? Defibrillator, if it is not there, it is not there. If it is there, it will be helpful, because that defibrillator, it will help you also, it will give you a hands, or it will assist also the cardiac condition properly, and it will give a direct shock. But if it is not there, we will do CPR until they are coming, until we call and the ambulance came. If we didn't have an ambulance and we have to transfer the client with a vehicle, normal vehicle or pickup or whatever is there, in this case, possibility of injury also might be increased and possibility of death, or it is not necessary to be at death, it might be the complication, isn't it? If the hospital is not prepared well, if we no equipment is not enough for diagnosis, for treatment, for care, if no specialist is there, in this case also the care, when it is given by people who are not specialized or junior people, the possibility of complication or death, it might be more, isn't it? So this is the chain of survival. Everyone is depending on other. If anyone is lost, in this case, it might aggravate the problem. For children, it is different. We are going back. Firstly, it here in for adult, it is start with early recognition. For children, it is start with early access. No, this is adult. This is not for children. So it is the same. It is early access or early recognition, early CPR, early defibrillation, early life support system, early post resuscitation care or hospital care.
Mister,
No.
is there any limited time for this change for any of this method, especially in CBR?
What do you mean by limited time? Because
Range. There are any special range?
here,
Let's say if I see a person, maybe they have a problem and they have for
Yes. Yeah.
half an hour or 1 hour.
yeah,
When I see him, I started already in PCR,
CPR.
CBR.
See, again, yani, that as we said, we have to act as early as possible.
Yeah.
When we are acting early, the possibility for survival, it will be more.
Yes.
When any delay happened, in this case, possibility of complication or death will be more. So, when we recognize the case, immediately we have to act, we have to assist within seconds, within 10 seconds. When we are doing the CPR also, for rechecking that if the heart is working or if he is able to breathe normally, also the reassessment, it should not take, or the gap, it should not be taking more than 10 seconds. If this is your question. I might understand your question in another way, that if the CPR continued for a longer period of time, did you mean like this, or yani, if the patient exposed for CPR for half an hour or 20 minutes, is there a chance of survival? As we said, we will not stop if we start a CPR unless if the patient is able to breathe normally. If he retains the sign of life is returned back, or if a more trained person came to help, or other person is came to help and to take over, or if we are alone and we didn't get a help, we feel exhausted and we cannot do anything more. Or when the scene is become unsafe and there is a danger on the client and us. If we cannot then move the client, in this case we have to stop and we have to escape. So those are the conditions that we can stop by. So the continuity of care should be there in order to save the patient. This is for the pediatric chain of survival. This is the difference in between the adult and child. See here, it starts with prevention. But there it starts with early access or early recognition. Children are more sensitive, so we have to prevent the case because mostly it is preventable condition. For cardiac arrest in children, it's mostly due to something with the breathing, either due to suffocation. It's mostly due to suffocation. So we have to prevent it. How we can prevent it? We have to prevent the child from while eating and running at the same time. Some of the people they want to play out, so instead of sitting for taking their food, they are taking sandwiches and they are run and they are eat while they are running. So there is possibility of suffocation in this case. We have to prevent those activities. Also, for a small infant, they are exposed to suffocation. Suffocation, it might happen due to the feeding itself. Especially, it can be with breastfeeding or the bottle feeding. Bottle feeding, in some of the ladies, when they are giving the milk for their children, instead of carrying them and giving them the feed, they are putting them in their bed and supporting that feeding bottle with something and left him to do some other work. In this case, they might expose to suffocation from the breast milk, the feeding itself, from the milk, the artificial milk that they are taking. So, when feeding the child, the lady should carry the child as if she is giving him breastfeeding in the same way. A second thing sometimes, and it is some rare cases that happen, that some of the ladies, they are putting the child beside her while they are doing breastfeeding for them, and sometimes they might sleep, so they might come over the child sometime and he might suffocate due to that. So it's better always to carry the child in a good position for breastfeeding or artificial feeding in order to avoid suffocation and which will lead to cardiac arrest later. So mostly it will, in cardiac arrest for infant, it starts with breathing problem, then the heart will stop. Then early CPR for the child, if it is happened, early recognition and CPR, and prompt access to emergency, it is the same system. Rapid BALS, the basic life support system. Integrated post-cardiac arrest care, which is the first links of which is linked with the basic life support. So it is the same that we have to have a unit for ICU or intensive care unit for the children also in order to take care of them. So it is mostly similar, except that the first one, it starts with prevention. Because most of the cases, can be preventable cases in case of children. You heard sometime about the what we call it swallowing of the tongue. بلع اللسان. Actually, it isn't. We can say that it's slang, because there is, when you heard that swallowing of the tongue, you expect that the tongue is going back and back to the throat. The tip of the tongue is going, isn't it?
Yeah.
No. So you think like this, but actually it is not like this. So, sorry?
Muzzle of the fan turn off because the mic.
Yeah. So it is not the tongue. It will not go back. The tip of the tongue is not. It is relaxation of the muscle. Why relaxation of the muscle? Sometimes at the playing ground, what will happen? Maybe the football is hitting his head, or due to some activity that he did, what it will lead to, it will affect the brain. So what will happen in this case? That there will be relaxed, because there is a cranial nerve that supply the base of the tongue. So when there is any condition that prevent the impulses or interfere with the impulses which going through those cranial nerve, what will happen? The base of the tongue, it will relax. So the base of the tongue, it will close the throat. It will close the airway. So he will not be able to breathe due to that closing. So what we can do, it is a very simple thing. Just to tilt the head backward and to lift the chair. By that, you open the airway. If it is done early, he might continue with the breathing and nothing might happen to him. But there are some cases happened and they were unable to do anything. They don't know what to do with them, and unfortunately death happens. So this is the about the chain of survival.